If you have trouble walking, you may have a disease more prevalent and deadlier than most cancers combined, called peripheral artery disease, poor circulation in main of the legs. If you've ever smoked, if you have heart disease, if you have diabetes, if you have chronic kidney disease, and you're having trouble walking, you might have PAD. And if you have PAD, here are your New Year's resolutions. Number one, I will not accept amputation without a thorough vascular evaluation and a second, even a third opinion from a provider experienced in limb preservation, a doctor known as a CLI operator, a critical limb ischemia operator, someone who is trained in advanced limb salvage. And if you don't know one, call the Global PAD Association's Leg Saver Hotline at 1-833 PAD Legs. It's up in the corner of your screen. Don't hesitate to reach out and we can help you find one and get expedited care. Number two, I will not accept normal or aging as an explanation for leg pain, claudication, leg fatigue, numbness, or wounds on my feet without appropriate testing, including an ABI, an ankle brachial index. It's where they put blood pressure cuffs on your legs and blood pressure cuffs on your arms. They measure the differential. They're measuring the circulation in your legs to see if you have PAD and what stage of PAD. You may also get a leg artery ultrasound. That is another option. And ABIs can get false normals. So if you are having those symptoms of leg pain, leg fatigue, neuropathy, and your ABI comes out normal, it's always worth saying, hey, doctor, why don't you perform a leg artery ultrasound as well, just to make sure. Number three, I will not go a day without movement. Exercise is, in fact, medicine. It is clinically proven. Even when it's hard, even when it's modified, I will move because circulation depends on it. Walking is medicine. Get that going through your mind, and maybe you will get motivated on a daily basis to get just one more step in today, one more step in today. And if you do have peripheral artery disease, that claudication that you get in your calf or in your thigh, that cramping that you get, push through that. It is when you're pushing through those leg cramps that you're growing those collateral vessels and also teaching your body, your muscles to adapt to less blood flow, to less oxygen to keep operating. So just keep pushing through, just one more step, one more step. Number four, I will not ignore food as a powerful tool for reducing inflammation and slowing disease progression. My daily choices matter more than occasional perfection. So just make one change every single day to improve your diet. And if it's only to remove all processed foods from your diet, make that your number one commitment for 2026. And number five, I will not isolate myself. And this is so important. I will stay connected, ask questions, and seek support because managing artery disease, well, it's not something that anyone should do alone. It can be debilitating, it can lead to isolation. But again, you don't have to feel alone. You don't have to be alone. Call the Global PAD Association's Leg Saver Hotline at 1-833 PAD Legs, and we will hook you up with some great support networks, including PAD Support Group.org, where you can find others just like you who are struggling to walk, who are trying to persevere, and they will be there right by your side every step of the way. But make sure, call our Leg Saver Hotline or go to padhelp.org.